Recreational cannabis is booming in New Mexico. The industry is generating millions of dollars in local and state revenue. But because cannabis is more accessible, there are more opportunities for it to get in the wrong hands. Despite all the money rolling in, investigator Brittany Costello found safety is secondary.
The operation is methodical, an attention to detail. These mountaintop extracts employees know is crucial to their customers. Cannabis gummies are just one option among the array of THC confections now lining dispensary shelves.
It's a personal responsibility, it's a business responsibility to make sure that community's safe and what we do doesn't cause harm.
Jennifer Merriman is president of Mountaintop Extracts, a cannabis manufacturer that serves retailers around the state. Born under the medical cannabis program, their products are now available to anyone old enough to walk into a dispensary. The appeal of these edibles has a wider reach, though it's hard to know just how wide. Even though the state legalized recreational cannabis, it didn't put into place ways to track cannabis-related accidental exposures. Hospital and emergency rooms don't have to report them to the state.
All of our calls are voluntary, so that totally confounds being able to interpret trends.
Dr. Susan Smolinski is director of the New Mexico Poison and Drug Center, the state's main source of exposure data.
How did the child get a hold of this?
Cannabis-related exposures are on the rise. Close to 250 calls last year, nearly half from hospitals.
We haven't seen a fatality from cannabis, but there have been from gummies in other states with young children. So it's definitely safer if you get a certain dose in a young child to be in the hospital.
The biggest increase is in elementary school-age children with edibles.
These older kids, the 5 to 10 who are getting into the edibles, I think we're seeing more serious exposures than in the past with them because they are eating more. They're eating the whole bar.
Edible products are almost always packaged with more than one serving.
For instance, like in a gummy bag, if it's a 100 milligram gummy bag, you would have 10 separate units of 10 milligrams.
Merriman says state standards around packaging are stringent, labeled with a THC warning and child-proof baggies or containers.
The thinking is if a child cannot get into that package, they're not going to accidentally ingest cannabis.
But once the package is open, it's a different story.
It's a bit of a learning curve for these families, and I think where it starts is with that stigma of whether or not to talk to your children about it and just open the conversation, and whether or not opening the conversation then leads your children to doing it, right?
CEO of Seedcrest, Shannon Jaramillo, is working with Mountaintop Extracts on a new education campaign to fulfill a pre-legalization promise that they say so far has fallen a bit short to keep cannabis products out of the wrong hands.
Check your treat before you eat.
An interactive way to get a serious message through to children and really anyone who consumes, even those who don't. Jaramillo says they're working on creating tools and resources to educate families and the growing New Mexico cannabis workforce. Now, they need some buy-in from dispensaries, nonprofits, even schools, and hopefully the state.
Understand that cannabis is here, it's not going anywhere, it's readily accessible, and that your kid or your teen could be coming in contact with it today, and you haven't had that conversation yet.
Without accurate data, it's unclear what the impact really is. We know these THC products are showing up in schools, but the Public Education Department doesn't compile or track that. The Department of Health does have a group that will publish a safety report in December 2024. Brittany Costello, 4 Investigates.